Hi, everyone, and welcome to Next Gen MD with Dr. Lily Johnston, incredible vascular surgeon out of Southern California. She focuses on both vascular surgery as well as metabolic health, getting to the root cause of what is blocking your arteries throughout your entire body, which I find so important. But today we are going to talk about the five things that she wouldn't tell you about vascular disease if you didn't want to be offended. I find this topic very funny, um, Dr. Johnston, and I'm really curious. What is that first one that you would say might offend me if you started talking about vascular disease?
The first thing I would tell you if I weren't afraid to offend you is please pay attention to your symptoms. And if they're getting worse, get seen, right? People come to me and say, well, doc, this has been going on for a year or two. And I want to scream because if it's been going on that long, we have lost all this opportunity to address the root cause of the disease, potentially avoid an intervention, a procedure. So don't wait for it to get bad. And if you are worried because you have a strong family history of heart disease, don't even wait for symptoms. Get checked, figure out if you have disease, and come talk to a specialist before we come to a place of having to do procedures to save your leg. Don't wait.
And for those people that would be offended or those that would go, okay, thank you, Captain Obvious,
Yep,
right?
it's okay.
Of course, if you're having symptoms, things don't feel normal, you should go to the doctor. But yet we still delay and we procrastinate. And a lot of that comes with a fear of what the doctor would say. We have a lot of folks in our African American community that have told us over and over again that they have a fear of going to the doctor, and they literally do not go, especially some of the men do not go to the doctor because of fear. They know they should, but they have this fear of what the doctor will say. And so they end up waiting until it's too late, where they do have a wound on their foot, for example, that's just not healing, or gangrene. Or we even had a woman, oh, bless her heart, she had a plastic bag tied around just above her knee because the smell was so bad from wet gangrene. And you know where that leads you. So it's not always Captain Obvious. If you have symptoms, you need seen, right?
And this is a very important point to address, Kim, because you are so correct. Many patients are afraid, and it becomes self-perpetuating because they say, well, my brother had this and he went into the hospital and got an amputation. I don't want that. And it becomes this thing where when we delay, then that is kind of what's left. But we have to acknowledge that, especially our patients who are Black, Hispanic, Latinx, they have been misserved or disserved by the medical community for a very long time. And there is a decades long history of abuse and mistrust that we are trying to overcome. But I can appreciate why many of those patients are afraid. They have reason to be. And I cannot promise that your physician, your surgeon will tell you something good. I cannot promise that they will hear you, but I can promise that your best chance of a good outcome is to go in as soon as you know there's something wrong. And we're not going to solve the inequities in healthcare today, but I do hear and understand that that is a very real thing for many of our patients, and I wish it weren't true, but it is. And we have to still do our best to provide reassurance and care for those patients and give them the best chance at a good outcome.
Yeah, and make sure you like this video, subscribe to our channel at The Way to My Heart to get more great content like this, and to get notified when Dr. Lily Johnston is on every week for Next Gen MD, because she's going to help you get prepared for your appointments, talk to you about what to ask your doctors, and make sure that you're so informed, and that'll ease your fears going into these appointments. So don't forget to do that. So, Dr. Johnston, what other issues might offend me when it comes to vascular disease? What's number two on your list?
The number two thing I would tell you that might offend you is your stent, your bypass, your atherectomy is not a cure for the disease that you have. It is a stopgap solution for one blood vessel or one extremity, but plaque formation in the artery, atherosclerosis, is a systemic disease. It is involving the blood vessels in your heart, the ones that go up to your brain and in your brain, in your legs, in your arms. And some people get it in some vessels more dramatically first, right? Some people present with a heart attack. Some people present with leg symptoms, claudication. Some people present with stroke. I have not figured out how to get a crystal ball to tell me which one of those will impact you, but the cause of death in most of our PAD patients is still heart attack and stroke. So you need to know, just because we did a bypass or a stent and your leg feels better, you still have this disease. And we must work diligently to reduce your chances of having a heart attack, a stroke, or needing another procedure in the blood vessel that we worked on.
Yeah, I love that you say that because we always tell our patients through the Global PAD Association that it's not a matter of if the stent or the bypass is going to go down, it's just a matter of when. Some, are more durable than others. And if you're mitigating your risk factors, maybe less of a chance sooner rather than later. But the reason you have a procedure is to heal a wound on your foot and to relieve the pain so that you can walk, 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 so that when those bypasses and stents do go down, you will have built an amazing array of collateral vessels or natural bypasses to keep you on your feet and stop that revolving door of procedures, right?
Yeah, absolutely.
So the stent and the bypass doesn't mean that you get to stop the work. You've got to do your part. So number 3, what other things could offend me that you might have to say about vascular disease?
Number 3 is a big one because number 3 references number 2, and it is that this is as much your work as the patient as it is my work as the doctor, right? What I want to say here is there is no pill, no procedure that is as good as the lifestyle and behavioral things that you as my patient do every day, day in and day out. Okay. There is as much work on your end for the perfect outcome or the best outcome as there is on my end. And that comes as a shock and a disappointment, I think, to many patients. They want me to have the easy button and to fix this, but there is nothing that I can do that doesn't work better and doesn't give us the best outcome as much as the behavioral modifications, the lifestyle interventions. What does that mean? That means what we eat, what we put in our mouth every day, how much we move, whether we can walk, 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 or do strength and resistance training. It involves our sleep and our stress and making sure that as much of our day-to-day behavior is in alignment with good vascular health, good leg health as we can do it. If you're going to rely on me as your doctor to just give you a pill and do the procedure, I will do that. Like, that is my obligation, but it's never going to be as good as if we partner together and we both do our part to improve your health and your outcomes.
And that especially includes diabetes control because we had a patient whose blood was just thick and sticky and clotting and just awful. And the surgeon called me and said, "Hey, do you have a diabetes reversal expert that we can send her to get this diet under control? Because I can't keep doing procedures. I'm ready to just cut off her leg because that's the only option, or we're going to be doing interventions every 6 weeks because that's really where we're at." And the amazing thing was within 3 months, Dr. Johnston, you would not believe her blood, everything just got so much better. She is now, literally since that last procedure and getting her diabetes completely under control, she has now gone a year and we're still going without having another intervention.
Oh, Kim, that is remarkable. And I'm so glad that the surgeon recognized that and got that patient connected to the resources they need. I am passionate about nutritional interventions for diabetes control and reversal or remission, depending on what language we use. But that is such an important intervention. And I think that story really captures the power of that. The other thing I would ask is, does that patient just feel better? Do they have better energy, better
Right.
sleep, better walking? I would imagine the answer is yes.
Yes. And you know what's interesting is we interviewed, and Josh, our YouTube producer, who's on here. So anyone who wants to write comments, our YouTube producer Josh is always on there, making sure we get comments and questions over to myself and also Dr. Lily Johnston, and to make sure you feel heard and that we can get your questions answered as well. But recently we interviewed a patient, Jody, who is 600 pounds, and it took one question in our network that about his cold feet that led him on the path to losing the weight. And he feels so much better. He has not had any sort of intervention for his chronic venous insufficiency or PAD that seemed pretty severe at that point because the extra weight on his legs. And he's working out every day. He's eating better and doing amazing. So there is a lot of power and impact of you being the best partner in your care and making those lifestyle changes, dieting, making sure your diabetes is under control, exercising, smoking cessation, it really does make a difference.
Couldn't agree more, Kim. It's so empowering and validating to hear those stories because I think patients are concerned that they're going to be judged, right? And part of this is getting your care team together and making sure that you have patient people in your care team who understand your medical issues because the diagnosis of obesity is a medical issue and it can be treated and managed like the disease that it is. And I think there's a lot of shame and stigma, particularly around the diagnosis of obesity. And many patients are afraid to come in and have that conversation. But, you know, I, for example, am going to be certified in obesity medicine later this year because I think it's such an important part
Yes.
of the care that I provide to patients and understanding how to discuss that without shame and stigma and how to provide patients an understanding of what is possible through lifestyle, what is possible with the adjunct of medication or surgery, and have that be a part of our integrative conversation about whole patient care because that is a diagnosis that impacts every part of their life, not just their legs and their blood vessels. And so I am so excited to hear that that patient got resources through the network and has made changes that are providing huge dividends. That's so, so exciting.
Yeah, just make sure don't compare yourself to anyone else. Be honest with your doctor, right? That's something that Dr. Johnston always says. And it's just about taking that one step, and it's that try, because talking to your doctor about it, you might even have a grander medical issue such as insulin resistance that may be leading to the obesity, and something that someone like Dr. Johnson, who specializes in metabolic health, could actually help you with, right?
Absolutely. Yeah, that's one of my favorite things to do. So please make sure that you get that addressed, get tested for it. We can talk about that at some other point, but
Yep.
it's a huge component of what I treat and what I do. And it really does make a world of difference in a myriad of medical conditions for our patients.
Okay, we have two more things about vascular disease that might just offend me. What's number four?
Number four is just because your lifestyle is perfect doesn't mean I might not recommend medication. So I get a lot of patients who come to me from a health space, and they often come from a place of having had ill health for a number of years, finding their why and doing a 180. They've transformed their life. And whether it is a whole food plant-based approach, a very low carbohydrate approach for diabetes reversal, Mediterranean diet, a race walking program, they have done a 180 and changed their life and they feel amazing. And they have some residual effects from either family history or from the years where they were metabolically unwell. And they come and say, Doc, look, my numbers are great now. I don't want to be on any medication. And that's their prerogative, of course. But what I will offer is that we still have residual disease, right? I have looked and there's plaque, or we have abnormal imaging and testing. There's still a problem. And I am so excited that you have taken your health by the horns and done everything you can to optimize it. And still, we may need to add on some medication or even a procedure if there is residual risk from your family history and your genetic component, or from the many years where you were in ill health. And it's not your fault, but it's where we are. And please don't see that as a failure. And please don't see it as, oh, it's just sick care system and the doctor's going to make all this money off the drugs. I'm offering that to you to maximize your risk reduction. And you can decide to do it or not do it. But many patients are offended when they come to me and I say, I still recommend some medication to reduce your risk even further above and beyond what you have already done an amazing job with your nutrition and your movement and your quitting smoking and all of the things you've done. There might still be more to do.
We always hear that with when it comes to statins, but what I think the doctors don't also recognize, because many people say, oh, well, my cholesterol is normal or it's now under control and I don't need them any longer. But what the doctors, I think, miss in terms of having the conversation with their patient is that these statins do more. I know there's a lot of side effects that people contend with, and it's about finding the right one for you with the least amount of side effects. But it's they reduce inflammation, which is really critical. And I don't hear that enough from doctors in the conversation with their patient. And I think that that's important to note as well, especially when it comes to vascular and cardiovascular disease.
Kim, we're going to have to do a whole episode on statins because this is such a nuanced issue. And I think there's a lot of fear and a lot of misinformation on both sides. Okay. There's truth to both camps, the camp that says they should be in the water supply and the camp that says we've been lied to, these are overprescribed and they should never be used, right? I think there's truth in both sides. I fall in the middle. I make both sides unhappy. And to me, that says probably that's where the truth lies. But we're going to need a little more time to dig deep into what's the difference between primary prevention and secondary prevention. What do the guidelines say about that? What is the true impact of these medications above and beyond the lipid lowering? And we're going to really dive deep in that another time. But it's a very nuanced conversation, and it depends a lot on where you present in your disease process. If you have just had a major bypass because your P.A.D. was so bad, you had wounds on your feet, we're probably going to turn up the volume on your lipid lowering to get that inflammation, get that anti-clotting, get all those pleiotropic effects, and reduce the impact of inflammatory lipids in your blood vessel walls, because we need that bypass to stay open. As time progresses, maybe we come down on that. But and if you're coming to me with intermittent claudication at a mile, no, I may not put you on high intensity statin therapy, but we can talk about that. And that's part of an informed, nuanced consent discussion.
Yep. And I love that you do the advanced testing to determine, if the statin is actually right for you and not just blanket throwing it out there and saying every single patient needs this. And that was really key as well. And that helped with my dad in his situation, where it turns out that the statin was not right for his situation and didn't make a difference. So it just depends on the patient, their presentation of disease. And finally, number 5, and we'll let you wrap things up here. Round out the top 5 things that might offend me about vascular disease.
The last thing I will tell you that might offend you is your health may or may not be your fault, but right now, in this moment, it is your responsibility. It is your responsibility to take ownership of where we are today and what we can do together as a partnership going forward. You may have a bad family history. You may have trauma in your past or other medical issues that led to weight gain, the use of nicotine, drinking, whatever the case may be. I'm not saying it's your fault. A lot of stuff happens to all of us as human beings. It's not your fault. However, we have one short and precious life and one short and precious body to carry us through that life. And I want you to take responsibility and ownership from today forward for what happens to you and with you, right? Please be my partner in helping me get your legs back to where they want to be to reduce your risk of stroke and heart attack. It's not your fault, but it is your responsibility.
Yeah, let go of what you can't control, focus on what you can control, and be the best partner in your care. Thank you so much, Dr. Lily Johnston. We really appreciate you being here. If you want more great content such as this, go to youtube.com/the the at sign, the way to my heart, and subscribe to our channel and get notified every week when you can actually be here and hear from Dr. Lily Johnston and so many other experts in peripheral artery disease. But don't forget, like this video, subscribe to our channel. Thanks everyone for joining us.
Thank you, Kim.